Okay, Tom. So you were just telling us about, really what an insight is, and a great example of the difference between an average insight, making something easier to use, versus a great insight, which was around, stability and how that actually helps the surgeon do his or her job. Let's talk more about how do you uncover those insights as a marketer. What are the ways that you learn from your customer? Is that through observation, through questions, just different things that you've done to uncover those insights and to keep probing deeper?
Well, here's what I typically tell my teams to do. And the first thing is go to the data, go to what's publicly available data to understand the dynamics of the market. When are these products, if you're studying a particular disease state, learn about the disease state, learn about how often complications occur, learn about what type of complications, get as much knowledge as you can before you even have a single conversation with a surgeon or a customer. Because oftentimes, what I have found is that teams will waste their time with valuable time with customers getting themselves up to speed with the category, instead of coming in pretty knowledgeable about, hey, I understand that in this procedure, 20% of the time after transecting the lung, there are air leaks that occur. Let's go into that. And then, so I've got a nice pathway in to have a discussion. But I wouldn't know that if I come in and say, well, tell me about lung cancer surgery. I'll waste the first hour just talking about lung cancer surgery and things I could have read about and gotten ahead of time. So I really encourage teams to
Interrupt you there. So, so what you're advocating is go read the literature, right?
read the literature, read any kind of, get any kind of information you can about market sizes, prevalence, any kind of data to improve your understanding of the disease state or the environment that you're working on. Then armed with that knowledge, then I think you have the most effective conversations. There are many tools you can use. Observation is a great one. If it's surgery, observation works perfectly. If it's not surgery, then a conversation can work just fine as well. And what I tend to do is encourage people in those conversations is to follow the care pathway. Let the customer, let the patient, or let the customer, or if it's a patient, or whatever you're doing, is walk you through what the pathway is, walk you through what standard of care is. What's the sequence? And then along that journey, as you're going through it, that's when you ask the questions. Why? What can go wrong? What do you do if something goes wrong? How did you make that judgment? Why is you? Think about the 5 whys. I mean, I think many people have heard ask why 5 times and you'll eventually get down to the root cause. That's really valuable in the case of doing customer interviews, is take them through something they know really well, which is the care pathway, which hopefully you know something about too, because you've done some of your homework. And then you can ask them questions about, why does this happen? What are some of the issues? Where do you run into trouble? What's the most problematic comorbid condition that you might face? How do you deal with it? Why? Again, observe mismatches. Mismatches in what they say and what they do. So if you're watching surgery, that's one of the classic ones, is they tell you one thing, but you're watching them do something different. And then why did you do that? Mm-hmm. I had a surgeon one time who I was found very interesting. He was closing up a case on bariatric surgery case, actually. And he goes and he asks the anesthesiologist to elevate the blood pressure of the patient, so make them hypertensive. And I'm thinking, oh my gosh, what is he doing? He's going to cause the patient to have a heart attack or have a stroke. And so I look at it, and then the next thing I see him doing is he says, look here. And all the staple lines, all the transections that he made were starting to glow red. And so what he would do is go and say, aha, there's a spot where I need to put some suture over it. I need to address that. And what he was doing in the essence was he was doing a pressure test in the most literal fashion to find out where the weaknesses were in his surgical technique. or where he needed to shore it up. And so for me, that was fascinating, because what he just gave me is a window into his thinking. And now I could ask him not 5 questions, but I could ask him about 20 questions of why. Why did you do this? How did you evaluate the risk of elevating the patient's blood pressure versus the risk of maybe an internal bleeding event after surgery? And it was fascinating because that allowed us to address questions of how do we improve hemostasis in the staple lines, so that maybe you have more confidence going into at the end of the procedure, so you don't have to try that. Or maybe what came out of it, maybe in the case of that, maybe he was developing a new technique that somehow we could make it easier for other surgeons to follow. But in any case, is look for behavior, look for anomalous behavior that you haven't seen before. Those are the most fascinating, because there's usually some underlying reason why.
You know,
Look
and
for,
what I love about that example, Tom, is if you hadn't been in the surgery, you probably never would have heard about that,
never would have heard about it,
because
exactly.
those aren't the types of things that doctors will tell you that they do.
Yeah,
Either because they're afraid you might think they're goofy, or maybe it doesn't really follow traditional medical dogma.
yeah.
And again, to your point, you wouldn't have known to ask the questions about that.
I wouldn't have known. And it's just about being observant. Sometimes you can see compensating behaviors. They may, a classic compensating behavior might be is they do a transection, they have a staple line, and then you see them sewing over it. Why did you sew over it? Well, sometimes I get a leak. Why did you, again, why did you do that? That compensating behavior is often the sign of a need that's not met. And many times they weren't, your customer or whoever you're observing may not even realize that it's compensating behavior. They just do it all the time. That's why I do this. Well, I do it because I feel safer, or I've found that it reduces complications. Great source for insights.
Mhm. Great example. All right, let's take a little bit break and we'll come back.